Congressman, thanks for joining us tonight.
Thanks for having me.
You've wrapped up the year on Capitol Hill. All the lawmakers have gone back home. You a little closer to home than many others, but the result is still the same. There was no resolution on these expiring subsidies here, and you're part of the entire Democratic caucus and 4 Republicans who were pushing for a vote regardless.
Yeah, we had a breakthrough with the successful discharge petition where we got 218 signatures, 214 Democrats and 4 Republicans signed the petition to force a vote on the bill to extend the Affordable Care Act tax credits for 3 years. That means there will have to be a vote in January on that bill in the House. Speaker Johnson could have brought the bill up for a vote at any time after the discharge petition reached 218 signatures. He chose not to and instead sent Congress home for the holiday vacation, and we'll have to come back and try to pass that bill in January.
So these are those subsidies that were enhanced, as mentioned, during COVID. These help people pay for plans bought through the Affordable Care Act. The view of this, the long view is basically that many people believe Republicans are seeing this as a way, an end run around doing away with provisions of the Affordable Care Act here. But again, as mentioned, you have a number of Republicans who are on board with saying, let's have a vote on this.
Yeah, I think you see Republicans who are in competitive swing districts heading into the election year for them and realizing that failing to extend these tax credits will be a huge liability for them. I mean, folks will see their premiums double, triple, some cases even quadruple. An important thing to note is even if you're not someone who gets your insurance from the Affordable Care Act, if these credits expire, which means Affordable Care Act insurance will be too expensive for millions of Americans. They drop their insurance. They're still going to get sick or injured, go to the emergency room. That care costs money, and it drives up everyone's health insurance premium costs. So we're looking at higher health insurance premium costs next year for everyone because of Congress's failure to act on this.
Look, there's been a lot of talk about the merits of the Affordable Care Act, which obviously has been in place for about 15 years now. There are aspects that people like. I know the pre-existing conditions angle was something you had a lot of bipartisan support on. But, you know, it has been controversial. And President Trump has, even going back to his first term, promised he was going to repeal it and replace it with something much better. We've not seen that plan from the White House. But when you look at the ACA, what are ways, in your estimation, that you can improve it and strengthen it if it is to survive into the future?
Well, you pointed out some of the strengths of the Affordable Care Act, and it's important to remember, you know, what the health insurance world was like before the Affordable Care Act. If you had a pre-existing condition, in many cases you couldn't get covered. You could be surprised when your insurance company called to let you know you had hit a lifetime cap and they were no longer going to cover your cancer treatment. Pregnant women often didn't get the care that they needed from their insurance companies. So the Affordable Care Act has provided critical protections. It's expanded insurance coverage to tens of millions of people, hundreds of thousands of folks here in Virginia. So it's been a huge success story. We absolutely have more work to be done to drive down costs. I think building on the reforms in the Inflation Reduction Act that allowed Medicare to negotiate drug prices, expanding that can bring down prescription drug and health prices overall. I think there's a lot of reforms that we can look at. Republicans have put forward kind of a hodgepodge of bills, increased availability of health savings accounts, which is not a bad thing in and of itself, but doesn't solve the problem for a lot of people. Association health plans, which don't have a lot of the basic coverages and protections that the Affordable Care Act offers. So we got work to do to bring down costs, but right now these tax credits are an urgent issue because premiums will skyrocket in January if we don't act.
You have been in office now, not for the entire year. You took office back in September, and I just want to switch gears quickly before we go. This is the last time I'll be talking with you in this year. What have you learned? Obviously, working under Congressman Connolly for as long as you did, what didn't surprise you and what has surprised you about serving in Congress?
Well, I was sworn in on September 10th, rather, of this year. And, you know, it's an incredible honor to represent my community in Congress, to walk onto the floor of the House and speak on their behalf or cast a vote on their behalf. That's something I'll never, ever take for granted. We have huge challenges in the country and in the Congress. We're as divided as certainly I've ever seen it in my time working in Congress. Bipartisanship is fewer and far between relative to previous years. And so those are big challenges, but I'm an optimist. I'm an optimist about the country. I'm an optimist about the Congress. I think we can work through the difficult challenges that we're facing right now and come out stronger on the other side. And that's what I'm going to try to do.
Congressman James Walkinshaw up late with us here on the Final Five.